Heart failure is an important health problem. Hospitalizations for heart failure are really a burden. It's the first cause of hospitalization in patients older than 65. And moreover, we know that half of them are going to be readmitted in the first year after an initial admission for heart failure. So strategies to reduce the number of decompensations are really needed. The hypothesis of our study was to evaluate whether a strategy of lung ultrasound guided therapy may improve outcomes in heart failure patients. So we designed a single center, single blind randomized clinical trial with very wide inclusion criteria, patients hospitalized for heart failure, and with a few exclusion criteria, severe lung disease or life expectancy of less than 6 months. And patients were randomized into a loose lung ultrasound guided strategy or into a lung ultrasound non-guided strategy. Patients were randomized into a lung ultrasound guided strategy or into a lung ultrasound non-guided strategy. Lung ultrasound was performed in both groups, but the result was only given to the treating physician in the lung ultrasound guided group. The endpoint of interest was a combined endpoint of urgent visit or hospitalization for worsening heart failure and death. We found that the primary endpoint occurs in 40% of patients in the lung ultrasound non-guided group and in 23% of the patients in the lung ultrasound guided group. That is an important reduction of risk, and the number of patients needed to treat to avoid a primary endpoint was only of 5 patients. We have to acknowledge that our study has several limitations because it's a single center study and the sample of the size was small, but we also think that lung ultrasound is a very safe, inexpensive and broadly available tool and can help clinicians to detect subclinical congestion and to treat patients better.